Most medical services were probably still largely affordable on an out-of-pocket basis. And why do I say that? I will show you. I have a hospital bill from the 50s. In fact, my hospital bill at birth. And in 2011, my mother passed away, and she had a cancer diagnosis. And curiously enough, she saved, I'm one of 7 children, she saved a manila envelope full of things for each child, and she didn't tell us about them. So as my sister and I sat there looking at these things, everybody else had artwork. I love you, Mom artwork. My envelope, a hospital bill. So I was stunned initially to think how bad an artist I must have been. But after I thought about it, why on earth did my mother save a hospital bill? And I was born in July, and I'm in my late 50s, but not for long, so you can figure that out, 1953. And my father was a resident, and I think he had just finished his residency and not started his, or maybe not just finished his internship and not started his residency. So I think my parents paid this bill. This is my only theory I can come up with, and it's a pretty good one, that my mother would have saved the bill, but have never told me to not want me to feel badly about it. But what did my parents pay for 7 days for mother and child? Remember that? That was the standard of care then? 7 days for mother and child to be in the hospital, discounted to $138. And if you punch that into a CPI, back then, inflation calculator, consumer price index, oh, that's a different one. Excuse me, I really need my glasses. In 1953, $138. Well, fast forward to today. That in 1953, in 2013 dollars, is $1,203.10. $1,203.10. Now that would still, that's not insignificant, and you would still have to pay the obstetrician, but it's not ruinous. I don't think anyone would call $1,200 ruinous. So let's leave the 50s behind and get to the 60s. As Terry mentioned, Medicare and Medicaid passed in 65, implemented in 66. And why? Because as a society, we're always trying to do good and extend access to our people. And who was overlooked at that point when you had a predominantly employer-based system? The lower income people and people who were no longer employed. So Medicare and Medicaid, 1966. Let's fast forward into the 70s. I started graduate school in 76. And I have a master's in public health from Yale. In 1976, my textbooks were describing healthcare as in crisis. And you can go back and pull out passages from things that I was studying and reading about in the late 70s that you could just apply to today. Because we got what we asked for. What happened and what those Dallas teachers probably didn't think about was that health insurance is different from other types of insurance. We don't want to use our